Have you ever wondered what a complete medical history includes? It's not just a list of symptoms or ailments. It's a comprehensive look into a patient's health, a story that unfolds with each new piece of information, providing invaluable insight into the patient's current condition and potential future health risks. The journey begins with the chief complaint. This is the reason that prompted the patient to seek medical care. It's crucial to let the patient express their concerns in their own words, using open-ended questions to tease out the details. Next, we delve into the history of the presenting illness. This is a narrative of the illness from its onset, exploring the sequence of events and onset of each symptom. After allowing the patient to summarize the history of their illness, pointed questions can be used to gather additional information. We then explore the patient's medical history. This includes current and past illnesses, even those that have resolved, such as childhood illnesses. The dates of past illnesses and their onset should be recorded. An immunization history should also be included in this section. The past surgical history follows. This includes all surgeries and the dates of each surgery. Specific questions about the surgeries can be asked if necessary, such as the reason for the surgery, its success, and any complications that occurred post-operation. Allergies are not to be overlooked. Inquiring about all drug allergies and the exact reactions that occurred when the patient took the specific medication is crucial. Environmental and food allergies should also be noted. Medications come next. This includes all medications and their doses that the patient is currently taking. It's important to ask the patient why they take a specific medication, especially if it's unfamiliar. Past medications also need to be known. Next, we delve into the obstetric gynecology history. This includes details about the menstrual cycle, obstetric history, and sexual history. Details such as the regularity of menstruation, the outcome of past pregnancies, and methods of birth control used are all vital pieces of information that need to be gathered. Inquire about the patient's menstrual cycle and establish the following. Is it regular? How often does menstruation occur? C. How long does it typically last? E. Does the patient have very heavy periods or very painful periods? E. When was the last menstrual period? E. What age was menarche? What age was menopause, if relevant? Inquire about the patient's obstetric history and establish the following. How many pregnancies has the patient had? What was the outcome of each pregnancy? What was the date of each pregnancy? What method of birth control does the patient currently use, if any? Inquire about the patient's sexual history and establish the following. Is the patient currently sexually active? If so, with how many partners? What type of protection is the patient using against sexually transmitted diseases? Has the patient ever been diagnosed with a sexually transmitted disease? When was the last pelvic examination done? Has the patient ever had any abnormal pap smears? If so, what was the treatment or the follow-up required? The social history follows, encompassing lifestyle factors like smoking, alcohol consumption, and exercise habits, which can all impact a person's health. Social history. The social history should include the patient's family life, employment situation, and daily habits. Elicit the patient's religion or lack of religious belief, and if practiced, currently. A history of alcohol use, cigarette use, and drug use should also be included. Be sure to inquire as to how much, how often, and for what period of time the patient has been using each substance. Other risk behaviors, for example, hang gliding, scuba diving, should also be addressed, as well as inquiring about diet and exercise. If you suspect that the patient has a problem with alcohol abuse, the CAGE questions can be asked. These include the following. 1. Have you ever felt the need to cut down on your drinking? 2. Have you ever felt annoyed when someone mentions your drinking or suggests that you cut down? 3. Have you ever felt guilty about your drinking or something that you did while under the influence? 4. Have you ever needed an eye-opener? I. Family history is also a key element. It includes information about diseases and conditions that run in the patient's family, which can provide insights into potential genetic risks. Family history. Inquire about the patient's spouse or partner, parents, siblings, and children. Take note of any medical problems in the family. Pay particular attention to common disorders with an increased contact risk, for example, tuberculosis, or an increased inherited risk, for example, diabetes mellitus or hypertension. Finally, we arrive at the review of systems. This is a systematic approach to evaluate the patient's major organ systems, looking for any undiagnosed medical conditions. In summary, a complete medical history is a comprehensive exploration of a patient's health, from the chief complaint to the review of systems. It's not just a list, but a narrative that provides invaluable insight into a patient's health, helping medical professionals to diagnose and treat their patients effectively. Review of systems. Following completion of the components of the history, a review of systems can be a useful tool for picking up any symptoms that may not have been mentioned by the patient previously. The review of systems should consist of an orderly set of questions moving from the head and neck downward. A good model of a systemic inquiry is as follows. 1. General sense. How have you been feeling? Have you had any recent weight loss or weight gain? D. Have you been feeling tired lately? 2. Head, eyes, ears, nose, throat. Have you ever had any problems with or injuries to your head? Have you had any headaches? Have you experienced any dizziness or lightheadedness? Have you ever had any problems with your vision? Have you noticed any changes in your vision? Have you noticed any blurred vision or double vision? Have you noticed any pain or redness of your eyes? And have you noticed any spots or flecks in your visual fields? Have you ever had any problems with your ears? Have you experienced any changes in your hearing? G. Have you noticed any drainage from your ears? Have you ever experienced any ringing in your ears? Have you ever had any difficulty with your balance? Have you ever had any problems with your nose? G. Have you had any drainage from your nose? Do you have any problems or pain from your sinuses? Ever have any nosebleeds? Do you have any nasal drainage dripping down into your throat? Do you ever had any problems with your throat? G. Have you had any sore throats? Or do you ever experience bleeding gums? When was your last visit to your dentist? E. Do you have artificial dentition? 3. Neck. Have you ever had any problems with your neck? Have you ever noticed any lumps in your neck? D. Have you had any stiffness of your neck? E. Have you noticed any difficulty swallowing? 4. Cardiovascular. Have you ever had any problems with your heart? D. Do you ever experience chest pain? E. Do you ever feel palpitations? And D. Do you ever feel short of breath? Do you ever wake up during the night feeling short of breath? Do you ever notice any swelling of your legs? 5. Respiratory. Have you ever had any problems with your breathing? Are you ever short of breath? If so, when? A. Do you have a cough? If so, is the cough productive? C. Do you ever have any chest pain? 6. Breast wow. Have you ever had any problems with your breasts? G. Do you do self-breast examinations? How often? Do you ever have painful breasts? E. Have you ever noticed any lumps? Do you have any nipple discharge? 7. Gastrointestinal. Have you ever had any problems with your stomach or bowels? How is your appetite? Have you noticed any change in your appetite? E. Do you have any difficulty swallowing? Do you ever experience heartburn? Do you ever experience abdominal pain? Have you ever vomited blood? D. Are your bowel movements regular? E. Have you ever noticed any blood in your stool? 8. Urinary. Have you ever had any problems with urination? E. Do you have any pain during urination? D. Do you notice any increased frequency of urination? Do you have any blood in your urine? D. Male. Is your urinary stream normal? Do you notice any reduced force of the urinary stream? Do you ever have any difficulty urinating? Hesitancy. Do you ever have any dribbling? Incontinence. 9. Musculoskeletal. 1. Have you ever had any problems with your bones or joints? D. Do you have any joint stiffness? Do you ever have any pain, swelling, or redness of any joints? Do you have any limitation of activity due to muscle or joint pain? 10. Neurological. Have you ever had any neurologic problems? Well, do you ever experience dizziness? E. Have you ever fainted? C. Have you ever experienced any numbness or paralysis? If so, where? Do you have any weakness of your arms or legs? 11. Hematologic. Have you ever had any bleeding problems? E. Do you ever experience easy bruising? Have you ever had a blood transfusion for any reason? 12. Psychiatric. Have you ever had any psychiatric illnesses? E. Have you ever had any problems with depression? E. Have you ever had any problems with anxiety? E. Have you ever had any suicidal thoughts? If yes, to any of the above. Remember, every piece of information, no matter how small, could be the key to understanding a patient's health. So delve deep, ask questions, and listen to the story that unfolds. Because every patient's history is a chapter in the book of medicine.